I totally agree with your questions. As an assessor, when I go for an assessment, I also have noticed the same thing. At the same time, when it comes to my hospital also, I am finding it the same way that problem is arising. The reason is that people have not understood exactly what is reconciliation. Reconciliation have to take place at every transition point. When I say like every transition point, it may be from the admission to the, and the patient has come to the casualty. From the casualty, the patient is being taken to the floor, to the ICU, to another area. Every transition point, we have to see that the reconciliation of medication is being done. Now, let me tell you what is reconciliation. When a patient with an accident, when they come to your emergency department, the person may be already having some other diseases like diabetic, hypertension, for which he or she may be taking some medication. So you have to add those medications when you prescribe new medication for this injury what he occurred this particular time, and that is known as reconciliation of medication. So when we put a patient to the ICU, shifting the patient from ICU to the floor, what will happen? Some of the medication we cut down and then we add new medication when the patient is being put to the ward. So there also the reconciliation of the medication need to be there. So every transition point of care, like in the emergency department, shifting the patient from the emergency to the floor, emergency to the ICU, shifting the patient to the ICU to the operation theatre, shifting the patient from the operation theatre to the ICU or to the floor. Every time you have to see that what medication the patient is on. Not only the medication what you advised this time, but already his previous medication what he is on, specifically for his other diseases like hypertension, diabetic, epilepsy, etc. So this is what all of you have to do in your organization so that you can avoid this NC.